Welcome to the August edition of the virtual webinar at Avalon University School of Medicine. My name is Faisal Malik. I'm the Associate Director of Admissions at Avalon University School of Medicine. We're just let you know, we are accepting applications. We still have some seats available, so definitely get in touch with admissions or myself. We'll be more than happy to help you out. We have Dr. Raza, he's matching in psychiatry. We have Dr. Crystal matching in surgery. But without further ado, let's give it up for our president, Dr. Samir.
Hi, good evening, everyone. My name is Dr. Samir Fateh, and I have the privilege of serving as the president of Avalon University School of Medicine. On behalf of our faculty, staff, and current students, I want to welcome you and thank you for taking the time to join us today. At Avalon, our mission goes beyond educating and training future physicians. We are dedicated to shaping compassionate, skilled, and resilient leaders in healthcare. We take pride in providing not only strong academics, but also a supportive community where our students thrive personally and professionally. Choosing a medical school is one of the most important decisions you'll make, and I encourage you to listen closely, ask questions, and picture yourself here as part of our family. This is an exciting step, and we're honored to share our story with you. Thank you.
Perfect. So now I'm going to go into the presentation, and then we will kick it off with the alumni panel with Dr. Raza and Dr. Christo. Like I said, my name is Faisal Malik. I went to a small school as well, and then the reason why going to a small school helped me was because my first year I ended up getting a C in a history class, but then the second year I took a more advanced math class. I ended up getting an A. The reason why I did that was because the history class was so large, 70 to 100 students, that was hard for me to get the attention of a professor. But the math class, it was around 10 students, and I was able to spend more time with the professor. And as a result, I got an A. Avalon provides that level of service. So that's why I'm a big believer in Avalon. What separates Avalon from other medical schools is that it's run by Dr. Fateh. Dr. Fateh has been teaching medical school students. He's been a doctor for 40 years, teaching medical school students, U.S. and residents as well. So he uses that experience to make sure the quality of the education is high. Let me share the presentation. All right, can you all see the presentation?
I can see it on my side, yes.
Okay, perfect. All right, so now for Avalon, here's what I'll be talking about. But before I talk about that, I want to talk about some of the similarities between Avalon and U.S. medical schools. Before I talk about that, I do want to thank everybody that's here to watch the webinar. Ellen and Maya and whoever's there, I really appreciate your support. All right, now similarities between Avalon and U.S. Medical schools are that students are able to take the same exams. Step 1, Step 2, Step 3, you'll be taking them the same as Harvard Medical School students, Duke Medical School students. You'll do the same clinical rotations as U.S. allopathic students when you come back to the United States. When it comes to the match, you'll compete for the same residency match spots as U.S. medical school students. The differences between Avalon and U.S. medical school students are that U.S. allopathic schools normally allow students only for the September semester, while Avalon allows students 3 times a year, January, May, and September. It's more flexible. Another difference is U.S. medical schools tend to be stricter with the requirements for admissions, while Avalon is more flexible. Another difference is U.S. medical school students will make students pay primary and secondary application fees, which go into the thousands, while Avalon will make students just pay an application fee for $50. But if you keep watching the presentation, we'll have a gift for you where you don't even have to pay $50 for the application fee. The shortage. There's a huge physician shortage happening. So it's good, everybody that's watching this presentation, because by the time 2034 hits, as long as you start medical school soon, you'll be in an ideal position to help with the shortage. States that are having the biggest shortage are Florida, Texas, and California. Okay, so here's some of our stats. So you can see why Avalon is a high quality school. If you go to Avalon, it's possible to come back and match into competitive specialties. Over 650 graduates have been practicing all over. We've had alumni match into neurology, surgery, psychiatry, radiology, pediatrics, emergency medicine, OBGYN. Our first-time pass rate for this past year was 92%, which is very impressive. Our first-time Step 2 pass rate for 2024 was 100%. Step 2 pass rate for the last 3-year average was 85%. Reason why our statistics are so impressive is because Avalon spends a lot of time with the students. Ways we help students for the residency match is that we do residency match, like we do residency videos, virtual videos. Our deans do them every 2 months, and they give you different topics to prepare you for the match. Other way we help is we have personalized career counseling sessions with the deans. Dr. Ghani, he's been a doctor for 60 years. He worked in surgery. He selected students for residency, so he shares his knowledge with these one-on-one counseling sessions. We also do mock interviews when it comes to the end of your clinical rotations. That's what U.S. medical schools do as well. With these mock interviews, it's like 45 minutes to an hour to give you feedback, and then that helps you prepare for the real interview when it comes time for the match. And if you have any other questions on how to match or you have a specific specialty you want to get into, feel free to get in touch with me, and I'll be more than happy to discuss it with you further. I'll put my phone number and email address at the end. Accreditation. Accreditation matters. Reason why accreditation matters so much is because I know a student, her aunt went to a school in another country, not Avalon. It wasn't accredited. By the time she came back to the United States, she passed all those tests there. She couldn't practice because it wasn't accredited. So she was in a lot of debt and she became a nurse. But with Avalon, you don't have to worry about that. Okay, so about 18 out of 80 schools in the Caribbean are accredited. Avalon is the only school in the Caribbean that has double accreditation for maximum years. So we're accredited with both CAAM-HP and then ACCM. With that accreditation, you have the peace of mind that as long as you do well, you'll be able to come back and practice in the United States without any issues. So we have a very diverse campus community. We have students ranging from 19 to 65, average age is around 23. We have students from all different countries: Puerto Rico, United States, Canada, Latin America, Pakistan, India, Nigeria. We have a 7-to-1 student to faculty ratio, class sizes of 25 to 40 students a class. We do peer tutoring as well. So if you're doing good in your classes and you want to get paid, you could be a peer tutor and help as well. For Avalon, we provide you with a faculty mentor. So that helps you with the whole school in general. We provide academic skills counselor to help you with the course, psychology counselor in case you're having trouble adjusting. And then that's 100% confidential. We have a nurse as well. We also do community events for students. So for example, in your first year, you could do nursing homes, go to nursing homes, and then that helps carry what you learned in basic sciences into the practical environment. And then second year, you do health fairs where you do blood pressure, BMI, advocacy for patient care. Can you all see the top left? Dr. Samir, do you see the top left? So if you look on the top left, okay, if you look on the top left, you'll see the beach. Then we have student housing on the bottom. Student housing is fully furnished. It's maid service a couple times a week. Electric, utilities, is all internet. It's all paid for. It's we serve meal plans as well. Meal plans are halal, so it's high quality meat. It's a minute walk from the student housing to the school campus. So everything's very close, very convenient. Avalon is one of the few Caribbean medical schools where you can get singles as early as a freshman. You can get a suite as early as a freshman, which has a kitchen in it. And then you can stay on campus the whole 2 years. You don't have to move around. Some schools are so big that they only let students stay on campus for 1 semester and make them move around. Bottom left is an anatomage table. It's like a vertical iPad. That's like a cadaver that you can keep using over and over again in case you want to work on muscles or bones. Bottom right is a cadaver, 1 to 8. So about 8 students can use it. We have patient actors. So those are some of the facilities we provide to students. All right, before I talk about basic sciences, I want to let you know everything Avalon has to offer. We have a 6-year Bachelor of Science to MD program. So in 2 years, you can get a bachelor's degree with Accredited, get direct acceptance to our medical school, go 4 years there, and then you can become a doctor. We also have a pre-med track. So if you're missing some prerequisites, then you could go straight into Avalon, and then it'd be like about a year, and then you could go direct acceptance into our medical school program for another 4 years. But then for basic sciences, we have two different tracks. If you have a 491 on the MCAT with a 3.0 GPA, you're eligible for our accelerated track. That's only 20 months on the island, learn basic sciences, pass step one, come back to the United States, do rotations. The regular track, you don't need an MCAT score, and if your GPA is around a 3.0, then you could do the 24-month track on the island, pass step one, go back to the United States, do clinical rotations. Our curriculum is an integrated curriculum. A lot of Caribbean medical schools use didactic, which is just subjects, but our curriculum is systems. Semesters 1 and 2, we do the same system, but we'll repeat it in a different way. And then semester 3 and 4, we work on the disease part of it. The integrated curriculum is great because it helps with memory and retention. Then for step 1, we help students prepare for that as early as day 1 when you have access to the AMBOSS question bank. Then we have a professor that'll help you with a step 1 prep course. We have a Kaplan review course that's included in the cost of tuition. That's around a $3,400 value. And then you would use that to study for the Kaplan course. So after you're passing the step 1 exam, you go into the United States, you do clinical rotations, 72 weeks of rotations. You do them either all of them in Chicago or Phoenix, or you can do the majority of them in Beckley, West Virginia, with some of them in Chicago or Phoenix. And if you want to, you can do some takeaway electives near your place, but you would just run it by our senior advisor, Jackie, and then she can give you the guidelines to get it set up. I think Dr. Raza did that, so he can talk about that later. But when you're doing clinical rotations, you are going to do them with U.S. allopathic students. So it's a level playing field. So it'll be balanced out. And it'll be in ACCM hospitals as well. So now, after you do rotations, you pass step 2. Here's the timeline. 4 years on the island, so 2 years on the island, pass step 1, 72 weeks, rotations, pass step 2, graduation, take step 3, pass that, residency, become a doctor. 4 years med school, 3 to 5 years of clinicals, 3 to 5 years of residency. Now, here's some student resources that we have to help students out with. We have the peer tutoring program we talked about. Research is very, very important, especially if you want to match. The more research that you have, the better your chances are of obtaining a competitive match. And I heard a student, she wanted to match in surgery. Her step 2 score wasn't as competitive, but she had 6 publications. She had 3 in surgery. That caught the residency director's attention. So she ended up getting a lot of interviews and matching. We just opened up a student task force this year to give students more opportunities with research. We have a research and journal club. We have a research day. If you want to do a poster presentation with research, we'll pay for your travel grant. We already talked about career counseling with our dean. Online, so Dr. Arja has an online medical education course. So that if you take that, that'll help you in terms of residency as well. Because when they select students for the match, they like students that can teach. Because as a doctor, not only are you treating, but you're teaching as well. You're teaching students that come in for clinicals, you're teaching patients, you're teaching residents. Avalon isn't just academics, we have clubs and organizations as well. We have Student Government Association, American Medical Student Association. With the Student Government Association, they did things like barbecue, picnic, beach day, soccer, marathon. If you don't see an activity and you want to do it, you can have that set up, and that helps students, and you can put it in your CV as well. Avalon is one of the most affordable schools in the Caribbean. So not only is quality important, which I already demonstrated to you, but cost is very important as well. The reason why I'm saying that is because if you go to school that's affordable, then you're not forced to work somewhere you don't want to. You'll be able to save money for a house. You'll be able to help the needy and really have an impact in society. Avalon's tuition is one of the cheapest I've seen. For a total of 4 years, is as low as $136,500. They're also very generous in giving grants and scholarships. If you pass step 1 the first time, you'll get a grant of $750. So for grants and scholarships, we offer anywhere from $500 to $50,000. So the higher your GPA or MCAT score is, that's a higher scholarship amount you'll get. We also help students out with payment plans. We're willing to work with students. And then this is what really separates Avalon, the student referral program. So let's say Dr. Samir gets accepted and he enrolls in Avalon, and I want to go and I put Dr. Samir's name down and I end up coming as well. I'll get $500 off of tuition for that semester, but Dr. Samir will get 25% off his tuition for the next semester, around $2,600. And it's not capped. So if Dr. Samir had 5 friends and they put his name down, he could potentially get free tuition. So that's a great benefit for y'all. We also, once you become an alumni, you'll have an alumni referral program as well. So if students put your name down and they end up coming, so students will get 500 off of tuition for that semester, but you as an alumni will get around a $2,600 check or 25% of their tuition. So I mean, and then that's not capped either. So those are some ways that Avalon helps with affordable tuition. So here's some steps to apply. So you would just submit an application online. Our admission staff will get in touch with you. If you submit all your unofficial transcripts, that'll help expedite the process. And then we'll set you up for an interview, virtual 45 minutes to an hour, and then we'll just take it from there. All right, so some of the prerequisites needed for medical school with Avalon are year of biology with labs, year of chemistry with labs, year of physics with labs, year of organic chemistry, some math, humanities. And then if you have 90 credit hours, you're free to apply. But if you have a bachelor's degree, that's even better. So our school is located in Curacao. Curacao is a very modern island. It's near Aruba, Venezuela. It's away from the hurricane belt. No hurricanes in over 150 years. Some islands are boring, nothing to do, feels like prison. Not ours. When people go on cruises, they want to go to Curacao. So things that you have in the United States or Canada, we have here. McDonald's, Burger King, KFC, Marriott, Starbucks, Apple Store, they're all in Curacao. And Curacao is a vibrant downtown area as well. Arianis was a student I worked with in Puerto Rico. So when she visited Curacao, she liked it so much, she said Curacao is better than Puerto Rico to her. So she really felt that Avalon helped her every step of the way, and I'm happy she feels that way because we really take pride in helping our students at Avalon. We're very student centered. One of our deans likes to brag, Dr. Wilson likes to brag that we're one of the kindest schools in the Caribbean, and I really agree with that sentiment. I feel like there's a huge shortage of physicians out there, so we're accepting applications for the January, May, September semester. The deadline for the September 2025 semester is next Friday, August 29th. So definitely recommend submitting your application because the sooner you do it, the sooner you could get a salary and the sooner you can make a difference in society. So here's my contact information in case you have any questions. And then this is the code, webinar 2025. So now that you've heard my presentation, let's kick it off to the alumni panel. If you all have any questions, feel free to type it in the chat. But I will actually let's introduce yourselves. Dr. Christo, Dr. Raza, do you want to introduce yourself?
Sure, I can go first. So my name is Dr. Lamprakos. I'm a Avalon alumni. I graduated in January, and I just started my residency in general surgery.
Hi, everyone. Thank you so much, Mr. Malik and Dr. Fateh, for inviting me onto this platform to speak and share about my experience. I'm Dr. Raza, and I'm on the same boat as Dr. Lamprakos. I actually know him. We did rotations together, and I know him from the island as well. So I also graduated in January, and I just started my residency in July.
Thank you. Thank you. All right, let's kick it off with questions. So students, if you have any questions, mention it on the chat, and then I'll be more than happy to ask them. All right, so can you both give students tips on medical school success?
Sure, I guess I can give some of my inputs. So medical school is going to be radically different to anything that you have studied in your undergraduate degree. You're basically completing approximately 1 year of undergraduate education per semester. And there's 5 semesters in the basic sciences. So there's going to be a lot of material coming at you quickly, and you need to be able to manage. So it comes down to time management. If you're not able to have a organized study schedule, you're going to struggle significantly. And so that's basically the most important thing. I think you got to have good time management and reach out early to your professors if you're struggling with material, if you're not sure what's going on, if you need a mentor, link up with someone who's an upper year or an alumni to get some guidance on how to prepare for exams. I think that would be the best way to sort of navigate your way through medical school.
Yes, I agree with Dr. Lamprikos, everything that he said. And just to kind of add on to that, yeah, medical school is completely different. It's like drinking out of a fire hydrant. And if you're not ready, you can get hit like you get hit by a bus. But I believe from my experience that it all boils down to organization skills, being proactive, and just trying to understand what kind of personality you have as a student. Are you someone who is a visual learner? Are you someone who does good by reading textbooks or watching videos or practicing questions or doing Anki flashcards? So just identifying that early will set you up for success, because that way you can kind of create a plan how you're going to study for your classes. And it's always a good thing. And what helped me was studying the day before for what I'm going to learn the next day in class. So when I would go to my classes and my professor is teaching me about pathology, anatomy, whatever it is, I have some understanding of what I am learning. It's not like I'm sitting there in the class completely blank. And when I go back home, it's easy for me to revise, and I don't spend that much time studying the same material over and over again. And I'm able to study in the same day the material for the next day. And it's just a cycle that repeats, and it helped me out.
Yeah,
Thank you.
just to kind of add on to that, Dr. Raza, Avalon has this unique perspective called a flipped classroom, which is basically you go in and the teaching is a little bit different. So be expected to show up and be like, okay, I would like you to discuss everything you know about small bowel obstruction. I'd like you to discuss everything you know about heart physiology. And so the onus is basically flipped on you. And then in that way, it quickly exposes your deficiencies in physiology and anatomy. I thought that was very unique, and I really enjoyed that perspective.
I want to add to that actually the flipped classroom that you were talking about, Dr. Christo, because I've heard you learn more, you retain more when you're teaching students as well. So with the flipped classroom, you're able to do that. So that's good you brought that up. All right, so you matched into surgery and then you matched into psychiatry. Do y'all want to talk about how did you obtain that? Because that's very competitive. And how Avalon helped you.
Sure, I guess I can go first. So I've wanted to be a surgeon since I was, you know, way before undergraduate. This was a kind of a dream for me. Avalon sort of prepared me. We did like mock interviews. Dr. Ghani, he's a general surgeon, and he sort of, would ask me these comprehensive questions like, how would you manage, small bowel obstruction? How would you manage, postoperative ileus? Like, how would you they ask you some of these questions in the interview just to gauge your level of training, your level of diagnostics. And so that was really helpful for me. I also got the opportunity to work with a number of incredible general vascular ENT surgeons. And so I was able to have quite a bit of surgical experience when I was going to the interview. I managed to log close to 500 surgical hours of assisting through my 2 years of clinical rotations, and I also was able to do some research. There are some preceptors that are very research oriented, and if that's what you're looking for, they provide you the opportunities to do case reports and publish research articles. So that's kind of how I was helped along this path.
Yeah, so typically there's two types of students that enter medical school. One are those types of students that know what kind of physician they're going to be, like Dr. Lamprico was mentioning that, yeah, I'm going to become a surgeon. And the other type, they walk into med school saying they want to be one thing, they end up becoming something else. And that's the beauty of medical school, because through your exposure of clinical rotations, you really find what you love. And I was the latter type of student. So I walked in saying I wanted to be a plastic surgeon. And I remember discussing with Dr. Lampricos in our Beckley rotations about interest in surgery. However, when I did my psychiatry rotation, it was like love at first sight. I felt like I could really help that patient population, and kind of the stigma that they face, kind of help to address that. And and my experience in psychiatry was very vast. I was able to do a couple procedures which I didn't know even existed in psychiatry, like electroconvulsive therapy, TMS, those things. So that really changed my framework about the field, and I decided to do further electives in psychiatry to improve my exposure. Through that, I came across great mentors, great attendings that helped me and wrote me amazing LORs that eventually helped me during the application process for residency.
Perfect. Then, okay, so we have a question from Sophie. Sophie recently got accepted to Avalon. She's a superstar. So her questions are: how did the international Caribbean context shape your perspective on medicine or patient care compared to US Canadian schools?
Yeah, I guess I can start. So, I felt like going to the Caribbean really helped broaden my horizon, my perspective, and made me more culturally competent, and helped me understand the different cultures that exist and how that relates to patient care, building rapport with patient, trying to understand what they value and how we can incorporate that into treatment plan to kind of establish that and improve quality of patient care. And that kind of helped me when I was doing my rotations, because when I came to the States, I went to rotate in a rural area, a very underserved area in Beckley, West Virginia, in the Appalachia region. So I learned their culture as well. I did electives in big metropolitan cities like DC, where there are melting pots of different cultures, and that helped bring in more experience, more insight, and I was able to share that during my psychiatry interviews. And psychiatry puts a huge emphasis on importance of cultural competency, because it's a big theme in psychiatry. So when program directors were listening to my answers and they saw that I had this experience, and Avalon helped me, going to Curacao helped me, it made it easier for me to match eventually.
Yeah, I was actually told directly from some program directors that graduating from a Caribbean medical school shows a certain level of resilience, just kind of in of itself. You are on an island, you're in a foreign place, and there's so many opportunities and there's so much like stuff and fun to do on the island that it's easy to become distracted. I mean, this is a tourist destination for a lot of people, but you are primarily going there to study. And so some students will lose focus and kind of forget about that. But when you buckle down and you do the work, you learn how to be self-reliant and independent because you don't have a choice. You have to be. So training on the island, and then when I came to Beckley, West Virginia, with Dr. Raza, we used to see each other almost every day actually for a little bit. Uh, it's that you kind of carry that independence with you, and the other thing is, you're in the Caribbean, your mind sort of starts to think a little bit differently. Like for example, a couple weeks ago in the hospital, we had a patient. They had crazy fever. This was an internal medicine patient. They had crazy fever. They had gone on vacation, and everyone was like, "What's going on?" And it was just incredibly painful fever. And I was like, "Well, they traveled." I was like, "What if these guys have dengue? What if they picked up some breakbone fever?" And that was a really outside of the box sort of diagnosis that wouldn't really come up unless you're in the area and you kind of already are thinking outside of the box. So I really I think it just sort of gives you a different perspective.
That's good though. That going to Avalon, Caribbean Medical School gets you battle tested. I never thought of it from that perspective. And that's funny. You two have seen each other every day. You're seeing this is bringing back memories. This session. You're seeing each other again. You see Dr. Samir too. All right, Sophie's next question. And students, if you want to ask questions in the chat, feel free to do so. We'll do our best to get them answered. Was there a moment during your clinical rotations where you felt Avalon's training gave you a unique advantage?
To be honest, not really an advantage. I feel like Avalon gave me. Can we mute our mic? There's a little bit of feedback.
Yeah.
Yeah, that's good. Yeah, so I wouldn't say an advantage, but I did have a very strong basic science. And when you have strong foundation skills, things kind of just start to make sense. And then when you start to expand on them and you learn pathologies and you're able to connect ideas more efficiently. So I wouldn't say that it was like better or worse, but I did get a very strong um, basic science and a strong foundation for the clinical portion.
Yeah, I agree. I feel like our basic sciences is amazing as compared to other schools, even U.S. schools. When I rotated, I was rotating with DO students who study in America, and I found that not to be arrogant or anything in any way like that, but my understanding of basic sciences, my comprehension was a little bit better, and I could tell that we got feedback from attendings in every rotation, and generally students that attended Avalon had better feedback in regards to foundational concepts regarding certain types of diseases that are seen most prominently in the clinics or in the hospital settings, understanding the pathology, physiology behind those diseases. Um, we were able to grasp onto that much easier, much better. I feel like Avalon does a good job in regards to strengthening our basic sciences, making us competent to take the USMLE Step 1 exam. Because at the end of the day, like Mr. Malik mentioned, we are competing with US schools and we are eligible to take the USMLE exams. And in order for us to get residency, we have to show that we are at the level or beating that level of U.S. students in terms of our resume, our scores. And I feel like I can attest to that, that Avalon sets us up for that and it does a good job.
Perfect. Okay, so this is her last question. Were there particular experiences at Avalon that helped you stand out in residency interviews or clinical rotations?
Yeah. So I rotated in both West Virginia and Chicago. I did my OB rotation in Chicago. I didn't rotate in Arizona, so I can't speak for Arizona. But in Beckley, West Virginia, there was no residency program that was actively rotating with us for all the different disciplines. And I know some people have a different mentality when it comes to that. They say they prefer to rotate at hospitals that have residency programs during their medical school to get like network, to get LORs, and to eventually apply there for residency. I didn't have any issues securing interviews for residency. I was able to secure 24 plus interviews, and I didn't rotate at any place that had residency programs. But when I was doing my rotations, because there was no residents, it was just attendings and medical students. So I was getting up early. I was pre-rounding before the attending physician showed up. I was seeing all the patients, and we had access to electronic medical records. So I was writing progress notes. If there was new consults, I was writing the HNPs who were discharging patients. I was writing discharge summaries. I was able to do procedures. In surgery, I was able to close XLOP incisions, place central lines. Psychiatry, like I mentioned, I was able to do procedures like ECT, TMS. So I had a very hands-on experience during my rotations. And when I used to talk about this and share my experience during my residency interviews, it set me apart, I can tell, definitely from other candidates that were that didn't have this level of exposure, and my LORs definitely reflected this. So, and I recently asked my program director what was one of the reasons you chose me, and this is what he said. And transitioning into residency was easy for me. We use the same EMR that we did in West Virginia. I had no issue. It made my seniors' lives easy. They didn't have to teach me much. So overall, clinical exposure was great.
Yeah, and I can add to that my goal, my objective is to be a rural general surgeon. I want to be a general surgeon that works in a very small community because that will allow me to have the largest scope of practice. I can do EGDs, I can do, open X laps if I want to. I can, we've put in pacemakers. It's a quite large scope of practice, and that's where I wanted to be. Like, I had the opportunity to rotate at large university institutions, and that's not the direction that I wanted. And the interviews that I was pursuing were rural general surgery programs, and they had an appreciation that I had a background in the rural community, and I was connected to the rural community because there are certain issues and pathologies that they face that are not really understood well by heavily dense urban communities. So that's kind of what sort of helped me along those lines. And the same thing, Dr. Raza was saying, like, procedures, like, you are the go-to if the attending is busy. My attending was busy. They were putting a center line in a patient that was septic crashing, and the nurse comes over and was like, hey, this other patient is crashing, can you please come and take a look? And so that level of experience and critical thinking sort of forces you to start to perform and to think at the level of a resident, kind of before you even start your residency. So I have a really deep appreciation for that.
Perfect, perfect. All right, so this I'm going to get Dr. Samir involved in this question too. What advice do you have for prospective medical school students that feel their GPA or MCAT score isn't competitive enough to get in?
That's a good question. That's a common question. What GPA do I need to achieve? The great thing about our admissions process is that, our admissions committee, they utilize what's called a holistic approach. So what that means is that, yes, we do look at grades and your performance during undergrad, but that's not the only factor that would determine acceptance to Avalon. We look at the overall picture of the student. For example, if a student has done volunteer work, or if they've done anything that's can be said as extraordinary. Even more, every student that applies to Avalon has a video interview, and that's probably one of the bigger factors, I would say, in terms of getting acceptance. So yes, we look at grades, but we want to get to know the student as a person, right? So that would be my advice. I think that sometimes not everyone can get 4.0 GPAs during undergrad. Life happens, and there are reasons. Maybe it drops to 3.0 or 2.7 or whatever it may be. But at the end of the day, we're looking to accept students that are willing to work hard, that have a deep passion for medicine, and have that drive to be great doctors.
So I can just add to that, and I think, in my professional opinion, you should just take a shot. You know, you could wait. You could be like, you know what? Let me upgrade this. Let me take a few more courses. Let's redo an undergrad. Who knows? Like, who knows what some students are thinking? But you miss 100% of the shot that you don't take. And I think one of the great athletes sort of said something along those lines. And so I encourage you just to apply. And if you're unsuccessful, you also will get feedback. There's like a kind of a closing interview where you get sort of, you didn't make it because of X, Y, Z. And I think that's also very important because now you have a plan. You're like, okay, so now I got to work on this. I can maybe work on this, and I'll get some observerships, and I'll get some experience. And so you have direction. Some schools, they'll just say, okay, you know what, this isn't for you, or they'll say no, and that's all they say. And then you're left kind of thinking, what do I do now? What can I do? So I think that's something to think about as well.
You want to add
Yeah,
to that, Doctor?
and
Sorry.
yeah, sorry. So I'll just add on to that as well. And failure is not the end of the world. So just because your GPA wasn't the best, or you had to repeat a couple classes during undergrad, or you had to take MCAT multiple times, that's not going to hold you back from getting accepted into medical school. As long as you're passionate, you show passion, and the way you show passion is by what Dr. Lamprikos was mentioning, like going out of your way to be proactive and getting observerships, getting some clinical experience, observing a physician or volunteering someplace, showing that you're engaged clinically. And most of the time, what medical schools look for is that, okay, you have all this book knowledge, you have the grades, but you have like extracurricular activities that revolve around medicine. Like, how can we tell you're actually passionate about medicine? Are you doing this because your parents want you to be a doctor? Or are you doing this because you're actually passionate about patient care and you want to add to patient care and improve the quality of patient care? So, showing that you can get some type of volunteer hours at a clinic or something like that, and getting LORs from doctors in your community, and having them reach out and vouch for you, that can also augment your CV in a positive way and help you get admitted into medical school.
Yeah, I could say, firsthand, just to add on a little more, that, we've had many success stories, especially, over the years and within the walls of our administrative office. There are names that, come to mind that, they may have not done as well as they would have liked it during undergrad, right? But at the end of the day, the opportunity was given, and they just took that opportunity and ran with it, and have done extremely well for themselves. So I think that what Dr. Lamprikos and Raza are saying kind of goes with what I'm saying too. That if you feel that your GPA or your background is not as strong as you would like to be, it doesn't mean it's the end of the world.
Thank you all. Oh, and Wayne Gretzky said that, Dr. Christo. You miss 100% of shots that you don't take. So there we go. I know he was testing me. All right, so I think Maya asked this question. Can you speak about your experience with the interview process in residency and how Avalon helped you prepare for it?
Yeah, so I did a mock interview with Dr. Wilson and Dr. Arja, and this was like 2 days before my first real residency interview, and I got some great feedback. It was for about like an hour or so, and they were asking me all the standard interview questions. Tell me about yourself. Why'd you choose psychiatry? Why'd you go to Avalon? What is Avalon? Why Caribbean? Like all those, uncomfortable questions that can really throw you off during the interview session. And basically, it's a structured conversation, and you need to compose your body language. You have to compose your answers as well. You cannot show them that you're becoming anxious all of a sudden if they ask you, why did you decide to go Caribbean, why not American school, why that didn't work out. It's your answers, the way you play the twist on the answers. It can really make a positive change. And sometimes it can hurt you, but that's why the mock interview practice is very important. So I got great feedback. They taught me to use words like culture of collaboration, chain of commands, like specific phrases that people understand. Like, this person has interview practice. This person is a candidate who's in demand. Who This is not the first interview this candidate is having. He has experience. So that set me up for success, and I was able to secure a pre-match offer.
Dr. Crystal, you wanted to add to that?
I think I kind of already sort of mentioned how we had like mock interviews, and I was given tips from Dr. Ghani, and I felt a little bit more confident going into interviews when I had kind of an idea of like what they were asking. The other thing is the interview is not just, I may have made it sound like it's an academic, you know, grilling situation. It's not really like that. The interview is basically, can we get along with this person? And for general surgery, can we get along with this person for 5 years? You know, are we going to be friends? Are they going to fight? They're going to ask you, you know, how do you deal with conflict? And that question, what it really means is, if we have a conflict, how are you going to handle it? You know, that's what it's asking. So, you know, you get kind of coached on what do these questions really mean when they ask you, you know, these things. And when you have that kind of behind the curtain knowledge, you can answer them, like, you know, very easily, and the program directors and residents, they love to hear that. That's what they want, you know. And I was told by my residency program, like, they were thrilled that I was able to match at their program, because they're like, you seem like such a great guy to work with, and that's kind of, you know, what we wanted, because anybody can be taught how to do surgery, how to be a doctor. You can be taught that, but you can't be taught on how to, you know, get along with a team, and work in a group.
Thank you. Thank you. We have a surprise. We have a visit from our Dr. Burgess. He matched into neurology, so he's a neurologist. All right. So, can you talk about keys to matching into neurology and what you did to be able to obtain it? Because that's a competitive residency.
Yeah, basically I didn't do a lot of like research, so I wouldn't say research is your main thing you should focus on. It was more of building your letters and building your CV around things that you do in the community or around your medical school and in your training that is more neuro related. So if you have like community clinics for like epilepsy, there's like usually free clinics and stuff like that. That's also beneficial. Um, Doing like extra rotations in neurology related is always important as well. Um, so just focusing on the neurology aspect, it doesn't have to be like research or publications. So that's not what they want. They just want to know they have an interest into neurology. Your personal statements are huge. Everybody has a grandma or grandpa that had a stroke or who has Parkinson's, and everybody and their dog has had some sort of neurological injury. But having that neurological injury and using it to describe your passion and your interest for neurology and how it guided your education and how it guided your thought process into neurology is important. So understanding that process and focusing on that one aspect, not different aspects, is important. Um, but then also understanding that neurology is very broad and has lots of different facets to it is also important as well. And you don't, like I said, I didn't do research. I didn't do a lot of that, and I matched into neurocritical care and neuroendovascular. So you don't have to have research guided education or papers and publications to get to where you need to be. You just got to be dedicated into the topic that you want to get into and have that drive. It's not going to be handed to you whether you go into general surgery or psychiatry or internal medicine. It doesn't matter. It's not going to be handed to you. If you don't have that fire or that flame to show people that you're applying to, why you deserve the position over a US medical school graduate who probably has scored 50 points higher than everybody else, then you're not going to get the position. As simple as that.
Thank you. Thank you for the answer, Dr. Burgess. Appreciate it. All right, so let's transition onto the islands, because I'm sure you can remember the times that you were in the island for school. Any first day or first week of medical school advice, especially adjusting to the islands?
Can I just say one thing? I have to leave in like 5 minutes. I have to put a cooling catheter in a patient. Does anybody have any specific questions or anything guided towards me that I can help with? Neurology, neurocritical care, or endovascular, neurosurgery related?
Oh, you know what? Can we put your email? We'll put your email address in the chat because I think we have 9 minutes left because it'll close out. So I'm gonna give them
Sure.
your email address and then just have them reach out if they have any questions, if that's okay. But thank you.
Yeah, you can give them my cell phone number. You can give them my email, whatever they want. I don't mind. I have a critical patient I got to go deal with, and but I wanted to step in and just promote Avalon and say that I wouldn't be where I am today if I didn't go to medical school and if I didn't have the proper backing and support from my medical school to be where I am today. And I had the support, the dedication, and the guidance that I needed from Avalon. And my wife was critically ill, and I resigned in my 4th year of residency and took 2 years off, moved back to Canada, took care of my wife, and then rematched again back into neurology. And that entire, so I'd done neurology residency twice, and Avalon stood by me every step of the way, supported me, backed me, whatever I needed. They helped me out. They did whatever they needed to do. Um, and they made sure I had everything and anything I could ever want. So honestly, I don't know many universities in the U.S. that have offered that kind of support. So I can say that for 100% without question, without anything, Avalon by far went above and beyond. And I mean, I remember hearing about Dr. Christo himself, so I know, general surgery is not easy to match into. Going into surgery, I've essentially matched into a surgical subspecialty to neurology, and not once has it ever came up with, oh, so you went to a Caribbean med school. What comes up is, you went to the Caribbean. That is super cool. Tell me about your time there. What did you learn? What experiences did you have? That's what they care about. No one, part of my language, and I apologize, no one gives a shit whether it's Caribbean, US, Irish, Indian, Australian, Canadian medical school. You can do the job. You put the effort in. You got a fire under your ass. They'll hire you.
Thank you so much. I
Yes,
mean,
thank you, Dr. Burgess.
No
Yeah,
worries.
you're,
I couldn't agree more with that.
Yeah.
you want to
I
add to
mean,
this, Dr. Raza?
I'm
I
just saying,
completely agree.
it's
I
true.
completely agree.
I'm sorry about the potty mouth. I am Canadian.
It's
My
okay.
wife's
That's
kind
all
of
right.
about the
Hey,
rubs up.
speaking from the heart, right? Speaking from the heart's always a good thing. So nothing
And I
wrong with
can say,
that.
a patient that I took care of is a medical student at the university that I'm currently working at, and she had an AVM that ruptured within 2 weeks of her patient. The school basically put her in FMLA and essentially like resigned her from the medical school. So this is a U.S. medical school, right? Avalon, it would never do that, and it had friends in the school that have had problems, and Avalon still talks to them to this day if they need help with whatever they need. So you want support, you want good education. You got general surgeons, you got neurologists, you got psychiatrists, you have me. I mean, I like to toot my own horn. I mean, neurocritical care, that's not easy to get into, and then endovascular and neurosurgery. I went to Avalon, and till the day I die, Avalon gave me my career and has given me the job I have today. And if it wasn't for them, I'd still be in Canada doing nothing. So uh, it's up to you what you want to do.
This makes me happy to work here. I mean, this is impressive, Dr. Burgess. I
No,
appreciate
Ron.
this. I really appreciate you
Hey,
stopping
I
by
gotta
here.
go though. I gotta go put a
Yeah,
catheter in.
thank you
I'll
so
talk
much,
to you
Dr.
later.
All
Burgess,
right,
for your time.
have a good one. Have
Thank
a good one,
you.
Dr. Burgess. But look, what he's saying, he's clearly showing us why Avalon is the kindest school in the Caribbean, what Dr. Wilson said. So, all right, can we get back to that question? Or you want to repeat that, Dr. Christo, Dr. Raza? Transition to the islands?
Sure. So, from what I understand, question was advice on how we can transition to the island before we start medical school. Is that correct?
Yeah, transitioning to the island, and then how was it? How did you handle medical school in the Caribbean?
Okay.
Being successful.
So, so transitioning was easy because Miss Sharisa, she's the one in on the island actually who deals with immigration and all those things. So she made the whole process easy coming from the States to Curacao Island, and I stayed at the dorm, so it was very convenient, just right across the school. And in terms of how I was in medical school, I mean, it was the same answer that I gave earlier, that I would prepare the day before. I found out early what kind of personality I had as a student. I'm somebody who's a visual learner, so I prioritize watching videos and presentations over reading textbooks and Anki cards, and I reinforce that by doing questions every day, and that just kind of helped me do well on my exams and get by. And island life was always there. Of course, like Dr. Lampricos mentioned, not being excessively inappropriately enjoying yourself on the island, but when it's necessary after a big exam, go take a walk by the beach, enjoy yourself, relieve that stress, and then come back, hit the books again, study hard, do well. That was my life for my time on the island. Yeah.
The other thing about this with Curacao is it's a very well supported island. It's one of the ABCs. Uh, the roads are paved. A lot of some of my colleagues, they said like, "Are you moving to like a third world country?" And I'm like, "Dude, quite the opposite. Quite the opposite. It is like beautiful, colorful. Everything you could possibly need is on the island. That being said, it's a little bit more expensive to buy stuff. Like if you were to buy an iPhone or a computer, so I say bring extra chargers with you, and that's just a given. Basically, anywhere you go, it's going to be a little bit more expensive. Basically in the middle of the ocean. I don't want to freak you out, but yeah, you're in the middle of the ocean, and I was a big question bank guy. Just like Dr. Raz was saying, I was a big question bank. I would do questions on topics we haven't even started yet. We hadn't even studied. And, I wouldn't always do so well, but I learned the material rapidly and from the explanations, and it gave me more exposure. Exposing yourself to different ways a question can be asked is one of the most fundamental ways that you are going to succeed on your board exams, because they're going to ask you questions about heart failure, but they're going to ask you different questions, like maybe heart failure from venous congestion, heart failure from kidney hepatorenal syndrome. So it's like different causes of pathology, and you will get that variety by doing multiple question banks. So I went through UWorld, Amboss, RX. And I did quite a few questions, and that was my technique.
Perfect. So, okay, just to let you know, I put Dr. Burgess's contact information in there. I put Avalon Admissions and my contact information as well. I so we'll try to wrap it up. I'm really grateful that you two came. I want to know, do you want to give any advice to these students that want to apply? They want to get into medical school. They want to be successful. Any words of wisdom for them, Dr. Cristo and Dr. Raza?
If you're truly passionate about medicine, take the leap of faith, apply, and take it one day at a time. Trust the process.
Yeah, and I say just keep doing the things you're doing, like attending these webinars, reach out to alumni, current students, see if they can give you insight or guidance on how to apply, and kind of, I say just give it a shot. You'll never know what happens. That's kind of what I did. I was just said, you know what, let me try, and now I'm completing my second month of general surgery training.
Thank you. Thank you. Do you two want to put your email addresses in the chat in case the students have questions they can ask? And then I'm really grateful for all of you coming. Remember, you could still apply. I mean, we're accepting applications for September, January, May, September. Deadline's going to be next Friday, August 29th. Dr. Samir, you want to add some last minute words of wisdom?
Yeah, no, I mean, I would like to thank everyone that's in attendance. Thank you, Fazil, for hosting this a wonderful informational webinar. And thank you to our alumni, Dr. Lamprekos and Dr. Raza. I mean, to take the time out from your first couple of months of residency really speaks volumes. And when it comes to, I still remember when the both of you, before you applied and when you applied, when you joined, and to see how far the both of you have come, it not just me, but it makes all of us at Avalon so proud and happy. So great job to all of the work and effort that you guys have done. You know, you guys are a success story, really. So, but
Thank you.
and yeah, everyone that's watching, you know, I thank you for being here. And if you have any questions, please feel free to give us a call.
Y'all, thank y'all for coming. Have a good night and good talking to y'all.
Bye. Good night, guys.